Today's session will cover a range of topics related to smoking cessation, including health impacts of smoking, strategies and tips of quitting, and the support available to help you on your journey. We encourage you to ask questions and participate in the discussion, as our goal is to provide you with valuable information and resources to support your efforts to quit smoking. Without further ado, let's start our session. Please join me in welcoming our first speaker, our respiratory nurse clinician, Sister Lati.
Good afternoon. Can all of you hear me? If you can't hear me, please type down at the chat column so we can rectify it, okay? Thank you, Abigail, for the kind introduction. And to let all of you all know, I have a team of nurses from Education Nursing team and who have invited us. And I am very privileged to come and give this talk. Another thing which I want to say to you is tomorrow, 31st May 2024, is World No Tobacco Day. A day to create awareness on importance to quit smoking. And that day we want smokers to try to make an attempt to stop smoking. Thus, today's title of our talk is, Are you ready to quit smoking? So we will start off with a case study. I'll share a case study with all of you to make it more realistic, okay? So this is a case study of Mr. Mike. He is 66 years old, male. He works as an ex-security officer. He started smoking at the age of 12 years old. He used to smoke 20 sticks per day, but now he has currently tailed it down, reduced it to 10 sticks per day. His teenage son also smokes. The diagnosis Mr. Mike was diagnosed with was chronic obstructive pulmonary disease. That means a lung condition due to smoking. And to add on to it, he was also diagnosed with stage 1 lung cancer. Initially, Mr. Mike had only 1 admissions per year, but subsequently it became 5 times per year. The reason for persistent regular admissions was due to disease progression and due to his continuity in smoking. So if you look at Mr. Mike, on assessment, he appears overwhelmingly breathless, always breathless. He's pale, his heart rates are low, blood pressure is also low, oxygen saturation fluctuates. He needs oxygen at home, and at night he needs a breathing BiPAP machine, a breathing machine to breathe. He has also in between nebulization to clear his lung. Actually, he has a small hospital in his own house. When you listen to his lungs, there is a lot of noise, crepitation, and wheeze. His legs are bilaterally, there is edematous, that means there is swelling, and regarding his functionality, he is impaired. He does not go out on his own. Previously, he was independent, but now he is mostly housebound, and he lives in a 2-room HDB flat. His teenage grandson is a main caregiver, and the teenage grandson is also a smoker. So the treatment plan for Mr. Mike is to relieve him with his symptoms, optimize his quality of life. Then we want to give his treatment therapy according to his disease specific. And we do not want to strive to prolong his life. So the pharmacotherapy agents were like inhalers for his breathlessness, morphine, fentanyl. For his fluid overload, we give him diuretics, vaccination. And for non-pharmacological therapy, we taught him on activity modification, pulmonary rehab, oxygen therapy, and all those things. Today, we want to talk about smoking cessation. How many of you think it is important for Mr. Mike to stop smoking? Is it important for him to stop smoking? Think about it. Why do people smoke? Why do people smoke? Most of us know smoking kills, smoking causes heart attack, smoking causes lung cancer. Why do people smoke? Even the cigarette stick, each cigarette stick consists of 4,000 chemical, 400 toxin, and 40 carcinogens. So much of toxic product in a cigarette. Why is people still smoking? When I saw this 4,440, I was thinking of this number, CCC, is it? In Chinese, we call it as die, die, die. Why then are smokers still smoking cigarettes? This is another picture of a cigarette that consists of many chemicals, okay? Some of the chemicals are so surprisingly, it contains battery, liquids, lighter fluids, paint, consists of so much of content inside this cigarette. Actually, cigarette is a drug delivery device. To inhale the drug, they use this cigarette. And this cigarette, when a person starts smoking, it reaches the brain within 10 seconds. And when it reaches the brain within 10 seconds, it creates a high feeling for the smokers. Over time, the smokers get dependent on the nicotine as they get used to it. Then when they stop nicotine, it will cause withdrawal symptoms, and withdrawal symptoms. Then they experience tolerance and they want to smoke more. They get addicted to this nicotine. So nicotine is a very addictive substance. I always tell my patient, nicotine is like a chain. It chains you up when you get addicted to it. So nicotine is a very addictive substance. Smoking quickly becomes deeply ingrained habit, and it is also a psychological addiction. Patients who smoke, people who smoke, they feel that they have to smoke when they get up early in the morning, when they go to their car, when they walk to the bus stop. It is a habit of smoking. Some of them smoke because of after meals, before they go to sleep. These are some of these addictions. that causes them to be hooked up to cigarette smoking. So Mr. Mike is telling me, I've cut down my number of sticks. I used to smoke 20 sticks. It is good enough. I have cut down to 10 sticks. There is no need to stop smoking entirely. Is it true? This is what Mr. Mike thinks. He no need to cut. He has already cut his number of sticks. So, despite significant, see, Mr. Mike has this lung condition as well as lung cancer. But despite significant tobacco-related diseases, most of the smokers, 1/3 of them have this kind of mindset. They are they are in either pre-contemplative state or contemplative state. They are not interested to stop smoking. They are not interested to discuss about smoking. And they are not interested in finding any kind of help. They are not motivated. They use arguments and restrictive statements. Have you faced such people, such smokers who are very argumentative and restrictive when you approach them? So Mr. Mike will say, it is too late. The damage is already done. It's the only few pleasure I have in life. It's a habit I can't break. These are his excuses of not wanting to stop smoking. Why is it difficult to give up smoking? So Mr. Mike is going through a smoker's dilemma. Smoker's dilemma is he wants to indulge in his smoking. At the same time, in him, in his soul, he knows he has to restrain. So there is a fight between indulgence and restraining. Desire to quit and desire not to quit. One leg in the graveyard, one leg out. So it is because nicotine is a very addictive substance. So Mr. Mike says, even if I quit smoking now, I may still die early. There is an age limit to quit smoking. I am already old. Beyond this, there is no point in quitting as there is no benefit. Is it true? You can quit at any age. Your body starts to heal within 20 minutes after quitting smoking. So the what we did was to go through with Mr. Mike the 5 R's to quit smoking. Why is it relevant for Mr. Mike to stop smoking? His personal relevance. If he can identify cessation is important and it's relevant to him, we let him verbalize it. We try to get the relevance in stopping smoking. Risk R. Second R is to identify potential negative consequences of tobacco use. What did tobacco use? By using tobacco since the age of 12, what it has done to him. So he has to identify these negative consequences of tobacco use. Then the rewards of stopping. So if I stop after so many years, what will it cost me? What will it help me? How will it help me? So for Mr. Mike, the main reason for stopping smoking might be it might improve his breathlessness. His exacerbations will not be that frequent. So what are the roadblocks to identify barriers in cessation? So Mr. Mike is already 66 years old. So what was his roadblocks for stopping smoking? So if we can coach the patient, Mr. Mike, to answer these questions, to think about this and get an answer, we write it down and we will remind him whenever we see him for his consultation. We'll remind him, Mr. Mike, that day you said that this is your personal reason why you wanted to stop smoking. So we write it down and narrate to him at each clinic visits. So let us talk about how to help Mr. Mike quit smoking cold turkey. So what is cold turkey? Cold turkey is to stop using all tobacco products and fight your way through any withdrawal symptoms that arises. That means you decide a date when to stop smoking. So most of the people, when New Year come, they will say, I will stop smoking. Or when their birthday come, they will say, I will stop smoking. Cold turkey, from my experience wise, I see most patients who have sudden dramatic events like a major heart attack or a stroke. These people, there is high chances of cold turkey working on these people. So cold turkey is to decide when to stop smoking and to refrain from using cigarettes. So gradually, what is gradual method of stopping smoking? So gradual method is reducing the number of cigarettes. You see, Mr. Mike, previously he smoked 20 sticks per day. Then now he say he's using only 10 sticks per day. How did he gradually reduce it? So how can he further reduce the 10 sticks down further if he use this gradual method? So we can tell Mr. Mike that how to reduce further is he can cut down from 10 to 8. That means keep 8 sticks and tie your day by only smoking 8. See whether you are able to just maintain at 8 sticks per day or not. This is gradually reducing or postponing. So when there is craving occurring, so he do certain things to avoid this craving feeling. So Mr. Mike is telling me, I will feel worse after quitting. It's true. They might feel worse after quitting. Nicotine causes withdrawal symptoms may occur during the processes of quitting. But these withdrawal symptoms, instead of thinking it has negative signs, you think it has positive signs. It's a temporary symptoms. It will go away within a few weeks. So let's look at withdrawal symptoms of smoking. When you stop smoking, you have intense craving for nicotine. I told you, right? When you smoke, the nicotine reach your brain within 10 seconds. So it will slowly come down. Then you have the urge to smoke. You smoke another cigarette, right? To spike your craving feeling. So when you don't have cigarette at all, there is intense craving feeling. When you have intense craving feeling, there is a lot of anxiety, depression. Then there is change of appetite and weight gain. Why weight gain? Instead of smoking, people eat. So check on what you eat. Headache and dizziness. Problem of concentrating. If I stop smoking, I cannot think, I cannot work. Sleep disorder, fatigue and restlessness. They feel tired. There might be constipation, abdominal cramps, irritability and sweatiness, sore throat and coughing, nausea and vomiting, tingling of the hands and feet. These are the symptoms which smokers face. We must admit they are going through all these symptoms, which is difficult. We acknowledge them, and if we can guide them through and give explanation for each symptoms, relieve these symptoms, it will help them. So let's look at irritability. So irritability, we already said, because you have less nicotine, you are adjusting to a nicotine-free lifestyle. So what you do, your solutions for irritability: occupy yourself, do exercises, watch TV, occupy yourself to reduce your irritability. Exercise is a good form of reducing irritability. Then cough. Cough. Usually patients, when they stop smoking, they will tend to cough because it is the lung is recovering. So they have to clear their mucus which is stuck in their lungs for long term, right? So they tend to cough. So we encourage, let the cough, let go on coughing. At the same time, it will bring out all those phlegms from your lungs. And if it's very difficult, then you can take certain home remedies, honey with lemon, lozenges, or what over-the-counter medication to treat your cough when it is very intolerable. So when you're feeling very tired, no, nicotine has a stimulant, right? So also exercising, resting. Headache is because of no nicotine also. You can't concentrate, right? So it's also relaxation, methods of relaxation. So usually we teach our patients 4Ds to manage craving and triggers. These 4Ds, which we usually teach them, is delaying. Wait out the urge. When you are when there is an urge, you just wait, and the urge will go off. A few minutes it will go off. So when you wait, you either don't when you after food you usually tend to eat, then you just walk off immediately after eating. Don't sit on the same place. You delaying. Drinking water, sips of water. We teach them deep breathing techniques and distractions, ways of how to distract. So they have to come out with their own ideas. We cannot be feeding them, but they have to come out with these 4Ds, what they plan to do to avoid these triggering factors. Some people will say, I rather vape than go down to vaping and cigarettes. So they have this notion, thinking maybe now the trend is vaping, right? So if I vape, it will be less harmful, because you tell me the cigarette got 4,000 over chemicals, whereas this vaping got only lesser chemicals. Vaping is also cheaper, and whereas compared to your cigarette. So they can give you a lot of excuses, but vaping is very harmful. We do not know the content, especially the nicotine content in the e-cigarettes. Vaping causes lung injuries like EVALI, it causes, and many of those patients with vaping end up in ICU with ventilators, and they are also young patients. We see. I tried to quit and I failed, so it's no use. So Mr. Mike is saying, I tried to quit and I failed. It's no use. So many people have quit many times, several attempts. So if you are failing, you can seek professional help. Don't give up. So this Mark Twain says, quitting is easy. I've done it thousands of times. So relapse, talking about relapse. Relapse is part of a cycle, but not the end of a process. I tried it once, but it didn't work. Life is too stressful at the moment. Feeling of unhappiness, seeing one as a failure. To review, so when you relapse, each relapse is a learning lesson. So you take it as a learning lesson, experience it, see why you relapse. so that you can rectify it the next time. The only real failure is to stop trying. So all smokers go through this cycle, not interested. Initially, they are not interested. Then they start thinking about smoking. They make preparation to change, make changes. Then they are so happy they are maintaining the change, good lifestyle, and all. Suddenly they relapse. So they go through this cycle. That's why quitting smoking is not easy. The only real failure is to stop trying. So now I will call upon my next speaker, Hui Keng, to share on pharmacotherapies.
Thank you, Sister Lati. Hi, good afternoon to all of you. My name is Kui King. I'm actually a pharmacist from Tan Tock Seng Hospital. So I see patients, right, and at the clinic, and one of my duties is to support smokers to quit smoking at the smoking cessation clinic. So Sister Lati has shared with us generously about how to quit smoking. So are there medications that we can use to increase our chances to stop smoking? So let's take a look. So these are the medications that are approved for smoking cessation. They may look overwhelming, but don't worry, I'll bring you through one by one. As you may have observed, right, there are 3 approved medications for smoking cessation. So we divide them into the nicotine-based and the non-nicotine-based. First, we take a look at the nicotine replacement therapy, NRT for short. So how does NRT work? You may ask, NRT also give me nicotine. Won't I be addicted to NRT? Yes, NRT contains nicotine, but at a lower, slower amount than what the cigarette is giving you. So by releasing a small amount of nicotine slowly, NRT reduces the withdrawal symptoms when we try to quit smoking. So a recap, just as Sister Lati has shared with us, withdrawal symptoms include like craving for cigarettes, headache, feeling tired, lethargic and irritable, right? So these NRTs will reduce these symptoms and allows you to focus on the other aspects of quitting. And NRT is much safer compared to the cigarettes. Why? Because NRT do not contain those cancer-causing agents and the toxic gases that are found in the cigarette smoke. So we have 4 types of NRTs. So they include the NRT nicotine lozenges, nicotine gums, nicotine patches, and the nicotine mouth sprays. First, we take a look at the nicotine lozenges. So it's marketed under the brand Nicotinell. It is mint flavored. 1 milligram of these nicotine lozenges will replace approximately 1 cigarette. And how do we use it? So when we have the urge to smoke, we can actually suck one like a lolly and you suck it until the taste is strong. Then you place the lozenges between your cheek and a gum and suck it again when the taste has faded. So one lozenges can last us about 20 to 30 minutes. And where we're using the lozenges, remember to avoid like coffee, tea, acidic fruit juices, fizzy drinks 15 minutes before and during the consumption of the lozenges. Do not bite or chew the lozenges because, you know, nicotine is an irritant. So if we were to swallow too much nicotine at the same time, we tend to get like sore throat, mouth irritation, or throat irritation, and even cough. Okay, so these are the side effects of taking, you know, nicotine too much at a time. So next, we have the nicotine gum. So there are 2 brands, Nicotinell on your left-hand side and then Nicorette on your right-hand side. So if we are smoking about 20 or less cigarettes per day, right, then we use the 2 milligram gum. If we smoke more, then we may need the 4 milligram chewing gum. So how do we chew it? We actually chew it slowly until the taste is strong. And then you rest your gum between the cheek and the gum. You can wait for about a minute. Same thing like when the taste is faded, then you take out the gum to chew again. So you can use the chewing gum for about 20 to 30 minutes or so, and it may replace about 1 to 2 cigarettes. And same thing, 15 minutes before using the gum and during consumption, no coffee, no tea, no fizzy drinks, because this will affect the absorption of the nicotine through your mouth. Okay, and of course, because it's a chewing gum, don't swallow the gum. So we can see that the side effects of this nicotine gum is very similar, the same as the nicotine lozenges, but because you need to chew the gum, so that's why you may get some, you know, jaw muscle ache. And being a gum, it may stick to the dentures, so patients with dentures may not be suitable using the gum. Now we come to the nicotine patches. So we actually have the 24 hours patch first, and then later on, the rival company came out with the 60 milligram patch. So how do we use the patch? We should actually use it on our chest area or on our back. Make sure that it's clean with no wound and hair. Then we need to actually remove the patch from the opening and then paste it on the dedicated site and hold it there for about 10 seconds to allow the patch to stick properly. Then when we actually need to change for the next day, remember to use a different area because keep using the same site may cause a lot of irritation and side effects. So remember, don't use the same skin area for the next 3 days. And upon discarding, make sure you fold inwards so that it's out of reach of others. So this is actually as a guide, it's not a must to follow. So for example, for those like heavy smokers, we can use the highest amount of nicotine patch first, maybe for about 1 to 2 months. Then subsequently stepping down to the lesser amount is like step 2 and step 3 for the next 2 to 4 weeks. So because it's used as a patch, so sometimes we may get some like skin redness and itchiness. Yeah, so these are the common side effects that some patients will actually mention to us. And then if so, right, by changing the sites regularly, it actually helps to reduce the chances of getting itchy skins. And some patients actually feedback to us that they actually do tolerate this side effect as they continue to use the patch. Next, we have a relatively new kit in the block. It's called the nicotine mouth spray. It comes in a 1 milligram nicotine per spray, and it comes in fresh mint. So how do we use it? First, when we actually so-called like open up the spray, and then you can actually slide outwards. And then when you need to use, make sure you remember to prime it for first-time users like those that we're using our inhalers. And then we will actually spray it into our mouth. Make sure that it's under the tongue or inside of your cheek. Because if you actually touch your lips or into the throat, it's very stinging and then you cause a lot of irritation. So to close the mouth spray, you just have to slide it back and you actually just slid in very snugly and you can actually keep aside. So we suggest that you may use up to 2 sprays at a maximum dosage each time, about 3 sprays per hour, and in a total of 48 sprays per day. So the same thing, do not eat or drink when you're administering the mouth spray. So each mouth spray actually contains about 150 sprays. And so if a smoker smokes about 10 cigarettes a day, he or she may need about 10 to 20 sprays a day. And so one dispenser can last about 1 to 2 weeks. The mouth spray is actually sugar-free, but it contains this artificial sweetener. So even the patients with diabetes are able to use it. The side effects of the mouth spray include like nausea, headaches, abdominal pain, which are actually pretty common when we use nicotine. So we have shared about the nicotine replacement therapy. So now we come to the oral medicines, as you can see over here. So bupropion is actually one of the medications. It's actually unclear how this medicine works for smoking cessation, but it's thought that it actually works on the chemicals in the brain to bring about smoking cessation. So how do we take it? We actually need to start the medicine actually 1 week before the quit rate, because this one to build up the medication in the body so that we can concentrate on quitting smoking. So for the first 3 days, we'll take 1 tablet once a day, then actually step up to 1 tablet 2 times a day from day 4 onwards. And then the treatment will continue for at least about 3 months. Some common side effects that I hear from patients is they may have like nausea, vomiting, they have a bitter taste, and therefore that actually helps to deter them from actual smoking. And the next medicine that we have is Varenicline. It's actually also used for smoking cessation. Now this Varenicline is very interesting because it has a similar structure, right? As the same as like nicotine, quite similar. So the medicine, the Varenicline, right, will actually sit on the place where the nicotine will sit in the brain. By doing so, right, the medicine actually helps to reduce the craving and the withdrawal symptoms the smoker have when the smoker is trying to quit smoking. So how do we take it? Same thing. This one is also taken 1 week before the quit rate. And it actually has this very nicely packed in a starter pack of 2 weeks. So the first 3 days, right, you take the white tablet once a day. And then for the day 4 to 7, you take the medicine, the 0.5 milligram morning and afternoon. Then after which, right, the next week onwards, it will be a step up of the dosing. And then it'll be a 1 milligram tablet, which is in blue color in the morning and then in the evening. So what if I forget to take the medicine? Don't worry, if it's almost the next time, then you just take the usual dose. You don't double the dose to make up. It doesn't work that way. Okay, usually it lasts for about 3 months, sorry. But there has been studies that's done, right? If you actually complete a course for 12 weeks and you take additional course of another 12 weeks, it actually increases your chance of quitting. Now, when we are actually trying to quit smoking, right, some of the medications that we're taking may need some adjustment. So it's actually it's good that you actually inform your doctors, your nurses, and your pharmacists who's taking care of your medications, especially if you're taking things like medicines like trophylline, warfarin, insulin, because you will need some adjustments of these medications when you actually stop smoking. Common side effects of the varenicline includes like nausea, vomiting also, and then abdominal pain and feeling bloatedness is very common in patients who take varenicline. So one thing to note that for this medicine, right, for now, there's a supply issue from the company. So we heard that it may be back only end of 2026 for this supply of varenicline. Right, so in summary, these are the medications that are approved for smoking cessation. So do check with your pharmacist, your nurse, or your doctor if you're keen to quit smoking using these medications. So after listening to Sister Lati and myself, we hope we have motivated smokers to quit smoking. So if smokers want to quit smoking, quit vaping, where do they seek help? So Tan Tock Seng Hospital has our own smoking cessation clinic. So we're open on Thursday and Friday mornings. So if smokers find it inconvenient to come all the way to Tan Tock Seng Hospital just to stop smoking, right? We also offer teleconsultation where we actually see smokers through video and phone consultation. So usually the first visit may take about 45 minutes, a bit longer because we need to understand the smoking history, how many attempts you have quit smoking, finding out like what type of smoker you are, assessing your nicotine dependence score, and then after that, review the stage of readiness and to formulate the quit plan. So if Tan Tock Seng Hospital is too far for you, we still have our NHG Polyclinic. They also provide smoking cessation counseling. Note that it's only during weekdays. And then, so give them a call or, to book appointment, or just walk in to your nearest polyclinic to find out more. If the polyclinic is still too far away from your home, don't worry. You can simply call or walk into the community pharmacies. Your very commonly visited like Guardian, Watson, Unity. Sounds familiar, right? They partner with the Pharmaceutical Society of Singapore to actually start this Start to Stop program. So what does it mean? It means to start to speak to our pharmacists to help smokers to quit smoking. So your friendly neighborhood pharmacist is also there ready to support the smokers to quit smoking. All these options still inconvenient for you? Okay, we have this Health Promotion Board, the HPB I Quit program online. So the I Quit program provides a personalized journey based on the smoker's lifestyle, their habits, and the level of smoking dependence. So the smoker can decide whether they want the daily SMS tips or they receiving a call from the trained quit line advisors or this face-to-face counseling with the pharmacist. So there's all these 3 options for the smoker to choose and decide on. So the smoker can actually quit smoking, and then after 28 days, what happened? There's a reward of e-voucher worth $50. And then if you stay smoke-free for 3 months, then there's another reward of $30 e-voucher. And then if it's 6 months, you get another $20 e-voucher. So you see, all in all, you get $100 e-voucher for quitting smoking for 6 months. Quite a good deal, right, for the smokers? So in summary, be it smoking or vaping, they are really not safe and they harm your health. So there are no safer alternatives to cigarettes or vaping. The best way to keep you from safe is from the harmful effects of smoking and vaping is to stay away entirely. So with this, Sister Lati and Kwee King myself here, thank you for your attention and we welcome any questions. Thank you. All right. Hi, so there's this question that we get from Hannah. Thank you, Hannah, for your question. Are the spray expensive, MediSave claimable? Yeah, I'd like to share that for this nicotine spray, I'm sorry, currently we do not actually keep it in our Tan Tock Seng Hospital pharmacy. So you can only buy it from the retail pharmacies like Guardian, Watson, Unity. So that if my market sensing is correct, they cost about like $50+ per dispenser. And sorry, they are not MediSave claimable for now. Hope that's actually addressed your concern. If you have any budget constraints, then you can actually consider other alternatives. So you have any of us have any questions, do feel free to type in the chat, and Sister Lati and myself will try our best to actually address them.
You can unmute and ask us directly also.
Okay, if there is no further questions from the participants, and we'd like to thank everyone for your participation and thoughtful questions as well. We hope you found this session helpful and motivative. Special thanks to our speaker, again to our respiratory nurse clinician, Sister Lati, and our principal pharmacist, Miss Quiking, for sharing their expertise with us today. If you have any further questions or need additional resources, please feel free to reach out to us. So without further ado, we would like to wish you have a great day and best of luck on your journey to quit smoking. We will be sharing you the feedback form, so give us a moment. Okay. We will be sending you an email regarding the feedback form. So again, we would like to thank each and everyone for attending, and to our speakers, thank you so much for this very fruitful sharing to each and every one of us. Again, have a nice day to everyone, and we say bye-bye. Okay, participants can exit already.